All right, what is going on, everyone? Brad here with Top Tier Physical Therapy. If you're somebody that struggles with hitting depth in your squats, this may be just the video you need because in this video, I'm going to go over ways we can self-assess where that limitation in our squat is coming from and ways we can start to address that on our own. When we think of a squat, typically we're thinking of the mobility in our hips, our knees, and our ankles. If we have a limitation in one or more of those joints, we are more than likely going to have a limitation in how deep we can squat. And that's when you can kind of start to see funky movements of people when you watch them squat. You're like, that doesn't look normal. Probably because something is limiting them, whether it's their hip, their knee, their ankle, or multiple joints. So we're going to go over each individual joint, how you can assess, is this the joint that's limiting my squat? And if so, what's one or two ways that I can address that on my own? Before we even do that, it's important to touch base on that a squat is a squat. So my squat is going to look different than your squat. Your squat's going to look different than your neighbor's squat. And a lot of this has to do with how we are shaped. So specifically how our femur as it inserts into our hip is oriented. So we're going to talk about that first, and then we're going to get into some of the self-assessment techniques. All right, so one of the easiest things we can do when we're first trying to improve somebody's squat depth is to change their stance. So going back to when we're talking about the angle of the hip, there is something called a version of your femoral neck. So as my femur inserts into my hip joint, that's actually going to be angled a certain way, whether forward or backwards, which is going to change the movement dynamics of my hip joint. In a person who would have what we call retroversion of that hip joint, they're going to be that person that when they stand comfortably, they have this toe out position. All right. They are in an externally rotated position, which is what we need to get into when we squat. So someone that has their toes out already, they are going to be more comfortable squatting with their toes out. It's going to be easier for them to get into depth. The challenge comes when I have someone that's retroverted and I tell them, bring your feet more closer together and point your toes forward. What this is doing to that person is there's actually internally rotating their hip, which is the opposite direction we need to go into when we squat. So now this person has a more internally rotated hip. It's going to be harder for them to get into that deeper squat. On the other hand, I may have someone that has femoral anteversion, which is my pigeon-toed person. Their angle of that hip is more forward, so their resting position is an internally rotated position of their femurs, which is going to point those toes inward. If I ask that person to point your toes forward and stand shoulder width apart, well, if they're normally toes in, when I go toes out, that's externally rotating their hip. External rotation is what we need to get into when we squat. So this person's going to have a more open hip, and it's going to be easier for them to get into a deep squat. I am not somebody that has retro or anteverted hips, so you can see if I start toes forward, if I want to get deep into the squat, my toes automatically turn outward. So I may have a little bit more of a retroverted hip. So it's important to understand that not everyone is going to have the same squat mechanics. And the old adage of feet shoulder width apart, toes forward, that's not a squat position that works for everyone. So the easiest thing you can do to start is just widen your stance, point your toes out, see if that changes your squat form. I will tell you, if you're someone that typically squats with your feet closer and toes pointed more forward, and you are going to try it a little bit wider stance and toes out, you're going to feel like you're squatting like this. I promise you that's not what's happening. It just feels that way because you're not used to squatting with that wide of a stance. So number one thing you can do, change your stance, see if that changes anything. If it doesn't, then we're going to go forward with our self-assessment here, starting with the hip. All right, so to self-assess if my lack of mobility is coming from my hip, we can start in this seated position and just see how far I can get my feet up towards me. You're going to need some knee flexion to do this, but I shouldn't really need to pull my heel to my butt to get my knees up towards my chest. All right, so if I can get without bending my knees excessively, if I can get my knees up towards my chest, it's pretty obvious that my hip mobility is not what's going to limit my squat. Okay, if I was someone that I can't really get my hip beyond here, well, that's only about 90 degrees. It's going to be hard to get below parallel into a deep squat. The hip may be what is contributing to my pain. Another way we could do this is to just simply lay on our back and see if we can hug our knees in towards our chest. So again, my knees aren't really bent here beyond 90 degrees, and I'm seeing, can I get my knees up towards my chest? If I can, there's a good indicator that my hip mobility is not what's limiting my squat depth. If I'm not able to get my hips to my knees, or my knees to my chest, then the hip mobility may be what's limiting me. And we can go through what I like to give a lot of my patients with a hip mobility deficit, which is the butterfly PNF stretch. So the butterfly PNF stretch, I know a lot of us have probably done some kind of a butterfly stretch where we're pulling our feet together and letting our hip or our knees drop down to our side. For someone who has a lack of hip mobility, it's more than likely going to look something like this, where they're not all the way on the outside of their feet. They're a little bit more on the edges of their shoes or of their foot, and their knees are up towards the sky versus, bottoms of my feet together and knees all the way down to the side. So they're going to start in a position something like this, and this may be you. We can do this with weight or we can do it without weight. The version without weight is I'm using my hands to push my knees down to the floor and open up my hip here. So I'm going into external rotation of my hip. I'm pushing a stretch and I'm holding for 10 seconds. After 10 seconds, I'm going to lift my knees towards each other, but giving myself a little bit of resistance through my hands. So I'm pulling my knees out towards each other, but I'm resisting a little bit with my hands, making those muscles like my adductors and internal rotators work a little bit here. Really what we're trying to do is get these muscles, the adductors and the internal rotators, to relax a little bit to allow for that flexion, abduction, external rotation movement that the hip gets into as we squat. If we needed to, we could take dumbbells, use those to provide us with our stretch. Again, hold for 10 seconds, and then we're going through 5 or 10 lifts with our hip. This is one that I see a lot of success with. It's not a magic exercise, so you're not going to do it once and all of a sudden your squat depth is improved, but you do it enough over time, you start to see an improvement in that flexion, abduction, external rotation movement of our hip, which if you have a hip mobility deficit will allow you to get deeper into your squat. If we did the hip self-assessment and that's not what's contributing to our squat depth because we're able to get our knee to our chest, then we're going to move down to the knee and see if there's any self limitations here. All right, so to assess if my knee mobility is what's limiting my squat, if you can, you're going to comfortably get into a tall kneel position on your knees, and you're just going to see if you can sit back onto your heels. If you cannot comfortably sit back on your heels and get into full knee flexion, there's a good chance that your knees are limiting your squat. We need to go through knee flexion to get into a deep squat. If I'm someone that's had a history of surgery in my knee and I've never regained full range of motion, it's very possible that that knee is preventing you from going into the amount of knee flexion required to get into a deep squat. So simply sit back onto your heels. If you can't sit all the way to your heels, this is maximum knee flexion here. My butt is hitting my heels. I can't sit back any further. If I can't get into this position comfortably, there's a good chance that my knee is what's limiting my squat. So we can go through an exercise or two to address this. Quite possibly the most simple exercise to work on improving your knee flexion mobility is the heel slide. If you are someone that's had any kind of knee injury where you couldn't bend your knee all the way and you went to physical therapy or you went to PT after a surgery, I would put a large amount of money on a bet that you did this movement. It's a simple movement, but it's a very efficient movement. So we don't always need these flashy exercises to improve our range of motion. Sometimes it's just something as simple as a short duration hold of a stretch. So for the heel slide, we can use a stretch strap like I have, or if you have a dog leash, a piece of rope, really anything you can tie around your foot to pull towards your butt, that will work. So how this one is set up, we just lay on our back and we use the strap to pull our heel towards our butt. If we can get to this, it's a pretty good indicator that we're going to be able to get deeper into our squat. If before, we could maybe only pull to here. I would make the argument that the heel slide is sufficient enough because as you go through the heel slide, you're going through hip flexion and knee flexion. We don't need to do something where we're laying on our stomach and pulling our heel to our butt, because in a squat, we're not having an extended hip. If I'm laying on my stomach and pulling my heel to my butt, my hip is extended and my knee is flexing, and that's not what we see in a squat. So we see the squat, or we see the hip and the knee go through simultaneous flexion in a squat. When we do this heel slide, my hip and my knee are going through simultaneous flexion. The vast majority of people, the knee is not what's going to limit your squat, but they are out there, so this may be just the exercise you need. If the knee and the hip weren't a limiting factor for us, then we're going to move on to the ankle. Okay, so we've checked the hip, we've checked the knee. Let's say we don't really notice any kind of limitation in our hip mobility or our knee mobility. And the last thing to check would be the ankle. Anecdotally, in my opinion, the ankle is one that is the most likely culprit in your squat mobility deficit, with the hip potentially being a close second. Like I said before, it's usually not your knee. So when we're trying to assess if our squat limitation is coming from our ankles, it's a test retest here. So what we're going to do is go through a squat, kind of make a mental note of how deep I can get and what that feels like. Where do I feel that my limitation is? We're then going to do the same thing with our heels elevated on some kind of surface. So if you have a slant board, you can use a slant board. If you have a plate, I'm just using a 10-pound Rogue plate here. Or you could just roll up a towel and put your heels on it, and you're going to go through the same squat. So now, if you're somebody that squat depth is significantly improved as your heels are elevated, that may be an indicator that your ankle is what's limiting your mobility. If you are someone that you do CrossFit or you follow Olympic lifting, you may notice the lifting shoes that athletes wear have that wedge, and it's for this exact reason. We can get a lot deeper in a squat when we start in a more plantar flex position, because as we are going into a squat, we're getting this positive shin angle where my shin is coming closer to my toe, which is dorsiflexion of the ankle. If I don't have a lot of dorsiflexion in the ankle, I can start in a more plantar flex position by raising my heels, which buys me more of a runway for ankle dorsiflexion and allows me to squat deeper. So heel lifts may be an option for somebody if no matter what you've done, you cannot improve your ankle mobility. You could just go out and get a pair of lifters and squat in those. But if that's not something that's in the cards for you, or you don't feel like you're there yet, this is an exercise you can try to hopefully improve that ankle mobility. For this ankle mobility exercise, we may need to differentiate where we feel tightness in our ankle, if we do feel tightness at all. If we feel it in the front, we're going to want to kind of lean more towards one of these exercises. If we feel it more in the back, like a stretch, we might choose the other option. So the first thing you can do, put your foot up on a bench, and you're just going to go through a lunge. You're going to get all the way to the end until you kind of feel your heel coming up off of the bench, and you're going to make a mental note of, where do I feel this the most? Do I feel it more in the back of my ankle, or do we feel it more in the front of the ankle? This is going to tell us which exercise we need to choose of the two. So if I'm someone that's feeling this in more of the front of my ankle, that may be a sign that as my ankle goes into dorsiflexion, my bones are kind of bumping into each other, and I need better joint mobility. And one of the best things we can do for that is a band-assisted ankle mobilization. So it's best to do this one without a shoe on, get your foot nice and flat on the bench. You're going to take a band and put it around your foot. You want to get it below the outside and inside bones of my ankle. If it's above those bones, it's not doing anything. So put that band below the ankle, below those bones. I'm using a red band because it's easier to see. You're probably going to want something that's a little bit more strong of a pull. But once that band is right below those ankle bones, we're just going to go through a couple of dorsiflexion lunges here. So trying to keep my foot flat on the floor. What this is doing is just pulling one of my bones a little bit further back, so it's not bumping into the other bone, and it's allowing me more of a dorsiflexion mobility. So this is a joint mobilization to improve my ankle mobility. If I was somebody that, when I do that first lunge test, I felt this more in the back of my ankle, that may be more of a soft tissue restriction, specifically in my soleus muscle. So for that, I like to use a PNF stretch similar to the butterfly PNF stretch that we did for our hip, where we're still going to be up on this bench, but we're going to go through a stretch and contract cycle for the soleus. So kettlebell or some kind of weight is going to be on my knee. I'm going to lunge forward till I feel the stretch in the back of that ankle. Hold for 10 seconds. I'm going to back off a little bit and then go through a couple heel raises. So 5 to 10 heel raises. And then I'm going to go back into my stretch. And we're going to repeat this a couple times. So just like the butterfly PNF is trying to get those hip adductors and internal rotators to relax and allow more motion in the hip, this is doing the same thing where we're trying to get the soleus to quote unquote relax, to allow itself to elongate more, which will buy us more dorsiflexion. All right, so there you have it. There are your ways to self-assess if my squat depth or lack of depth is coming from my hip, my knee, or my ankle. Most importantly, just remember everyone squats differently. So my setup position for a squat is going to be different than yours. The first and the easiest thing you can do to see if you can improve your squat depth is to just widen your stance and turn your feet out. If that's something that works for you and improves your depth, maybe you're just someone that's a little bit more retroverted in your hip and you do better when you open up and externally rotate that hip more. If changing your squat stance does not change your depth at all, go through that self-assessment of the hip, the knee, and the ankle. Identify which areas you are limited in. So for the hip, I should be able to pull my knee towards my chest without significantly bending my knee. For the knee, I should be able to pull or should be able to go into a tall kneel and sit all the way down onto my heels. If I can't do that, then it's probably coming from my knee. And then for the ankle, test and retest your squat with the heel lift and without a heel lift. If a heel lift improves your squat mobility, which for about 99% of people, that's what's going to happen, then the ankle is probably what's limiting your squat the most. So hope this video helps. Comment below if you guys have any questions, and I will see you in the next video.